Health advocates are urging the Food and Drug Administration to finalize a proposed ban on menthol cigarettes and flavored cigars. They claim the tobacco industry has marketed these products to black Americans with deadly consequences. Research shows a menthol ban could save up to 654,000 lives over the next 40 years. A ban could eliminate disparities in lung cancer deaths among black Americans and other groups within 5 years. Joining us now is Dr. Philip Gardner. Now, Dr. Gardner is a researcher, public health activist, and co-chair of the African American Tobacco Control Leadership Council. Dr. Gardner, good morning. Thanks for being with us.
Thank you for having me.
So all cigarettes are bad, as we know, but what is it about the menthol and the flavored tobacco that makes it so addictive and so much worse?
I think we should keep in mind that menthol, by definition, is an anesthetic. It leads to a numbing sensation in the throat, and it allows for deeper inhalation. The deeper you inhale, the more toxins you take in. The more toxins and nicotine you take in, the more addicted you become. That's why the tobacco industry puts it in there. The more addicted you become, the harder it is to quit. That's simply what they've been doing for decades. And unfortunately, they've been directing a lot of their advertising and promotion of these products to the African American community.
Let's talk about just how difficult it is to quit these products, as you mentioned. Similar to drugs, alcohol, I presume?
Some of us would argue, being a public health doctor, that nicotine is probably the most difficult thing to quit, given what it does to your brain. On average, it takes people who want to quit at least 5 attempts to do that. And it's not a very easy thing. I think one thing that should also be said during National Minority Health Month, that not only getting rid of menthol cigarettes is important, but providing people with cessation services so they can have help. These services should be culturally tailored and language specific.
You know, these products, looking to ban these products, how difficult a task is that going to be when other tobacco products are legal?
No, I appreciate that, but I think we need to take it step at a time. They've been outlawed in Massachusetts, they've been outlawed in California, and there's hundreds of cities around the country that have prohibited the sale of menthol cigarettes and other flavored tobacco products. I think it is going to be hard, but I know in New York that the governor is proposing that these products be removed from the market, and I know in New York City that there's coalitions involved in trying to get these products off the market. So yes, it may be a hard push, but it's a push we need to make to save lives.
It seems like the stuff that's so obvious. We showed some of the statistics. It seems like the things, and I know we talked about it, I don't want to get into a huge political discourse here, but whether it's fast food, whether it's guns, whether it's tobacco, these things that are doing so much harm to people, that you think it would be easier to kind of remove some of these products from day-to-day life. Let's talk about the health disparities here. As you mentioned, April is National Minority Health Month. How would a ban advance health equity in your estimation?
Well, look at it this way. The main killer of African Americans, and all Americans for that fact, but for African Americans in particular, are tobacco-related diseases of lung cancer, stroke, and heart attack. And if you got rid of menthol cigarette, so the main vector into our community for those diseases are menthol cigarettes. If we got rid of menthol cigarettes, it would actually slow the pace of those being the most deadly things. Now, I appreciate we need to deal with the question of guns and fast foods and homelessness and 1,000 other things, but the main killer of black folks are tobacco-related diseases, and the main vector of tobacco-related diseases into our community are menthol cigarettes.
And does it bother you, though, when you've got local activists that express their opposition to something like this, like getting rid of some of these things that we're talking about now?
Well, clearly there's a lot of misinformation out there. The idea that if you get rid of menthol cigarettes, the police will go around arresting people for possession of these products. That's not true. Yeah. This is about stopping retailers from selling them. It would not be illegal to possess them. The whole idea that you're being racist if you take these cigarettes away from people. The problem there is that it was the tobacco industry's racism that targeted these things. Let me put it to you this way. In the 1953, only 5% of African Americans smoked menthol cigarettes. But by 1968, that had almost tripled to 14%.
Yeah.
By 1976, it had tripled, it had doubled, it had tripled again to 42%. And by the mid-2000s, it had doubled to over 80%. Today, 85% of African Americans smoke menthol cigarettes. And that's because of the predatory marketing, mass advertisement of these products, giveaways, promotions in our community.
Yeah.
So we need to stop that.
They know their audience, sadly, and that's one of the biggest issues here as well. Dr. Gardner, thank you so much for taking a few moments. We do appreciate it.
Thank you for having me.
All right. Good to talk with you.